Director of Early Care and Learning at the Colorado Department of Human Services. With me today is Stacy Kennedy, the Director of our Child Care Quality Initiative, and Karen Rosa, our Child Care Licensing Administrator. So welcome to the Colorado Child Care Development State Plan public hearing / webinar. There's a couple of process-oriented things I wanted to let everybody know. Currently, you are muted. At the end of every section, we will have people essentially raise their hand, which means clicking on the little hand icon next to your name. And then we'll be able to call on people and unmute people individually. We're doing that for a couple reasons. One, it just keeps the audio nice and clean because we are recording this webinar. And two, we won't have two people trying to talk over each other or ask similar questions. So with that, I'll get started. Quickly, I wanted to make sure everybody had a high-level overview of what the Child Care Development Fund is, otherwise known as CCDF. The fund is authorized through the Child Care Development Block Grant Act. That act was reauthorized for the first time in about 20 years in 2014. So for those of you who are familiar with the state plan that we are operating under now, that was the first state plan that was put into effect after the act, after the fund was reauthorized. That was in 2016 is when the state plan was first released, and we are still under that. We have a 3-year state plan period. We, throughout the last couple of years, have had federal rule promulgated. The majority of the federal rule was promulgated in September of 2016. So we've done several amendments to the state plan since it was first released in July of 2016. And we've gotten some federal guidance even as late as last month on some of the implementation of federal rule that we still have till September 30th of 2018 to come into compliance. So we'll get into some of that as we go through the plan, but that's to give you some context. The CCDF fund is the primary source of funding for the state of Colorado for the Child Care Assistance Program, as well as the primary source of funding for our Child Care Quality Initiatives and our Child Care Licensing Unit. So all told, it's about $100 million a year for the state of Colorado. And this plan is essentially how we apply for those funds. And it's also how we show that we adhere to the rules and regulations under the Child Care Development Block Grant Act. Okay, next slide. So currently, the state plan is, the draft state plan is under public comment and review. We are required to have that review be a minimum of 60 days. So that was posted in April, and it will remain open and available for the public to review and to make comments through June 11th. You can find a copy of this complete state plan on the Office of Early Childhood's website. And there's actually a form with that so that people can fill in comments based on specific sections. So if you haven't already done that, feel free after this webinar to post any additional public comments on that form. Again, that'll be open until June 11th. After June 11th, the division staff takes the public comments, takes the state plan, makes revisions based on public comment, and we have to submit it to our federal partners by July 8th. We then go through a pretty rigorous process with our federal partners to ensure that we have described everything in enough detail for the federal government to feel comfortable that the state of Colorado is doing its due diligence to be in compliance with the fund. And then after it's reviewed by both the regional office and the central office, the plan is usually approved prior to October 1, 2018. The state plan is then effective, as I mentioned, for 3 years. So this state plan period is October 1st of this year through September 30th of 2021. There are 6 major sections to the state plan. They include family engagement, access to stable child care and child care financial assistance, equal access to child care, health and safety standards and monitoring, qualified and effective child care workforce, and continuous quality improvement. And this plan is actually organized along these 6 areas of focus. And then I'm going to turn it over to Stacey Kennedy, and she may have something else to add about that, and then we're going to jump right in to some of the sections.
Good afternoon, everyone. As Erin said, my name is Stacey Kennedy. I am the director here within the Office of Early Childhood for the Child Care Quality Initiative. I want to talk about the first section, which is about promoting family engagement through outreach and consumer education. For each of these sections, we're going to give kind of an overview of what the law requires, and then talk specifically about some of Colorado's strategies. So this particular section of the Act is really to empower families to be informed decision makers as they're accessing their child care options, but also as they may need access to other supports that families may need outside of child care. And the real fundamental kind of focus of this is to ensure that we're promoting parent involvement and family members in the development of their children within child care settings, and just generally speaking, knowing that family members and parents are a child's first and best teacher. The strategies outlined in the plan, the draft plan, really focus on how we are assuring that this information is provided. And we have a kind of 3 main ways in which we do that. We partner very closely with our local DHS, Department of Human Services or Department of Social Services in the administration of the Colorado Child Care Assistance Program. And through that application process and case management supports that occur with families, families are provided with detailed information about, not just the subsidy program itself, but information in cases where, for example, a family might have a concern about their child's development and how to access a screening or an evaluation in regards to that, or health insurance, or those kinds of supports. The second strategy that we leverage is really in utilizing our websites. We utilize the Colorado Shines website, which is our quality rating and improvement system here in Colorado. And I'll provide a little more detail and a few images about kind of that site here in the next slide. We also utilize our Office of Early Childhood website to provide information for key resources to families, but also ensuring that they have information about the programs offered, not just within the Office of Early Childhood, but are kind of critical to that original mission of ensuring families are kind of engaged in promoting their child's development. The last strategy is really related to our child care resource and referral efforts. A few years back, we launched a statewide call center. We currently partner with Mile High United Way for that. And that information is kind of well advertised in a number of different locations, but really being sure that in cases where families have kind of special circumstances or needs with their children, that they're able to kind of talk through that with someone at no cost to them, and have kind of that very personal assistance. Our target audience are broad. As mentioned, parents are the primary focus, but we also very much try and use all of these strategies to ensure that information is available to both, in addition to parents, to the general public as well as child care providers. So, you know, the general public really reinforcing why quality matters in the care of children, along with just, you know, the general overview of these resources. And for child care providers, ensuring that they have information on rule, on application processes, if they're just starting a business, or how they can engage with the child care subsidy program in cases where they may not already be have a fiscal agreement in place. And then the last strategy is really something that happens internal at the Office of Early Childhood, making sure that if anyone has a complaint or a concern related to what's happening with their children or a known child within a child care facility, that they can go through a process and have a licensing specialist work with them on that particular case, and we would follow up in a real prompt way to be sure that we're addressing that immediately. So this particular slide shows just our Colorado Shine website. One of the most utilized areas of this site is the Find a Program Online site, which provides anyone that's conducting a search with information about specific licensed facilities within that area, has opportunities to narrow the search based on age of child, quality level, whether they accept CCAP. And the site itself is actually organized, you know, essentially for those three primary audiences as well. So this is where a provider, a child care provider, would find information on the Colorado Shines framework and other, you know, guiding documentation like that. The next website that we support is actually related to another requirement of CCDF, which is that we have what they call early learning standards. And in Colorado, that is our early learning and development guidelines. So we have in both English and Spanish the earlylearningco.org, which includes both printed materials at different stages of a child's development, as well as for different target audiences. But it also includes some media by which people can share through Facebook or other kind of social media, some video that reinforces kind of some key messages related to how we best can support children's development at those different stages. And then the last site is more of kind of a resource page. And this really looks specifically at children's social and emotional development, and provides information for to help anyone who's working with young children understand how best to nurture their mental health by supporting their social emotional development. And so all three of these are intended to be, you know, rich resource to anyone that's interested in obtaining more information related to the topics that we've covered. So with that, I'm going to transition it back to Erin, who's going to talk about providing safe and stable childcare.
All right, so this is essentially referring to the Child Care Subsidy Program, our Colorado Child Care Assistance Program. And with reauthorization in 2014, there was a real shift in this area in particular to ensure that not only are we providing child care so that parents can go to work or attend school, but that child care is high quality, stable, and creates a good learning and development environment for that child. So with that, there were some requirements imposed on the subsidy program, and you'll see them here. So the first one is that we must provide a minimum of 12 months eligibility for families. And that they are then redetermined, meaning that they apply again and are eligible for another 12 months. So no matter what, they have a minimum of 12 months at each application and redetermination. And this is to ensure that that child has some sort of continuity of care, stable environment. There's also more flexibility in the program than there ever has been before to allow for fluctuations in income. So now if a parent, for instance, is working hourly and they work over the holidays where they have a huge number of hours and then they go back to having very few hours, the income that they earn in 1 month isn't necessarily going to make them ineligible for the program. The program needs to look at irregular earnings and try to smooth that out over a period of a year, for instance. Again, this is to focus on ensuring that that child maintains continuity of care. Delinking of families' work schedules and school schedules is another change from last year, and we continue to maintain compliance with this. Essentially, if a family if an individual parent is attending school and their classes are Monday, Wednesday, Friday, but they need study time on Tuesday and Thursday, or their child really developmentally needs to be in a program 5 days a week, or that parent really feels like that's the best care for them because it's a preschool program that operates Monday through Friday. The Child Care Assistance Program now needs to be for the best interest of the child, not based on the parent's work schedule or school schedule. And again, that has been in place for a few years now. I think we still hear of cases where there's some confusion about that, but it doesn't even matter if a parent is working part-time. If they feel that that child needs full-time care, the parent can request full-time care for that child, and the county must provide for it. We also now allow for job search of a minimum of 90 days. Under current rules, it's 90 days or actually 13 weeks cumulatively throughout the year. That will change with the rule package effective September 30th of this year to come into compliance with the federal rule that requires that we give families 90 days of job search at each instance of non-temporary job loss. So anytime a parent loses their job within their 12-month eligibility period, they're eligible for a minimum of 90 days each time they lose their job. So they could get a job for 1 day, lose that job, and get another 90 days of job search. So again, it's the focus on the child and that stable care for that child. I also wanted to bring up another, for the irregular fluctuations in earnings, the program also allows for seasonal work where you have actual cessation of work. So if you happen to work in the agricultural sector and you are maybe unemployed for 3 months because you're a seasonal worker, the program allows for those temporary breaks in employment as well. And childcare is supposed to be provided through those temporary breaks. It would not make the family ineligible just because they're in a temporary job loss. And then the last one is policies for graduated phase out. So the state of Colorado, right now we have a graduated phase out that allows for a family to have 90 days after they are determined to no longer be eligible for the program. So this would happen at their 12-month eligibility period, and it allows the family 90 days to gradually transition out. That is not in compliance with the way the federal rule is written. The state of Colorado had two choices. We could offer another set of, a second set of eligibility criteria where we have a higher income level that families would then qualify under, and that would enable them to have, for instance, up to another 12 months of eligibility. But we as a state would have to prove that that higher eligibility income level allows families the opportunity to afford childcare on their own. And in a state like Colorado, where childcare is extremely expensive and the federal government defines affordable childcare as 7% of your gross income, you can imagine how high of an income 7% represents when we're looking at $10,000 a year, for instance, for toddler care. So the state of Colorado has opted for the second option, and that is to set our exit eligibility level at 85% of the state median income, which is the federal maximum. And then I'll get into that a little bit further in the presentation. But that's how we're going to be coming into compliance with that, this state plan. Lastly, we have to have procedures to ensure that we can serve those families experiencing homelessness, as well as those children in foster care. And we do that through a myriad of ways. One is that we allow families who are experiencing homelessness to gather specific documentation over a period of time. And they can have up to even 6 months to gather things like birth certificates, et cetera. And in the interim, those families are served and can be served without any penalty. So if the family doesn't have their income documentation right away, doesn't have that birth certificate right away, the child can still receive care while that family gathers those documents, because we know those families are in flux and they don't always have all of those critical documents on hand. For children in foster care, counties are able and allowed to offer protective services child care as an option. This can include waiving the income requirements on a case-by-case basis. And we have some new legislation that just passed this a few weeks ago, where counties are now, it's not just an option for counties, counties are going to have to make some exceptions for children in foster care. And so we will be issuing some guidance to counties on how to best do that, still on a case-by-case basis, because that's what the federal government requires. And then I think we forgot to pause after Stacy's section. So we've got a question. Is it for me or for? Oh, okay. It's a simple question. So the webinar is being recorded, and hopefully it's being recorded successfully. So that will be available on our website shortly after the webinar ends, probably by tomorrow. So I will pause there because we didn't stop after the section on consumer education. And so I want to give people an opportunity to raise their hand if they have any questions about the consumer ed piece of the presentation. Okay. Well, and feel free to use the chat box too if a question pops into your head in the interim. Okay, so we'll move along and we'll talk about some recent legislation that just passed that impacts the CCAP program pretty dramatically. As I mentioned, we had already determined through rulemaking that we wanted to go to 85% of the state median income as our exit level for the state. House Bill 1335 actually codified that into law, so it is now a statutory requirement. All counties must set their exit level at the federal maximum, which is 85% state median income. So to give you a sense of what that means, it's approximately 300% of the federal poverty level for a family of 4. House Bill 1335 also now sets a statewide eligibility entry level of 185% of the federal poverty level. This means that as long as you make less than 185, you either make 185 or less percent of the federal poverty level, you would be eligible for the child care assistance program. The law does allow for the state board to make adjustments to that entry level, and we'll be working with our state board over the summer and working on rule to present to the state board over the summer and in the fall, and plan to actually have proposed rule in front of state board early 2019 to allow for some flexibility with regard to entry level across the state. So stay tuned for that. And then lastly, the House bill requires that we do an annual market rate study. The federal government requires that we do a market rate survey every 3 years. But now we have state law essentially telling us that we need to do some sort of market rate study every single year, and that is because the county allocation is now tied to the market rate that are in that study. So we'll be working again with the Rule Rewrite Committee over the summer and fall to figure out what that looks like and how the market rate will help inform the allocation amount. And then we are also supposed to work with the Early Childhood Leadership Council to help design that market rate study. So, and I do want to point out that a study does not always have to be a survey. So for those of you who might have survey fatigue from this last market rate survey we just completed, please know that we're trying to not do a survey every single year. We're going to try and design it so that the survey could still take place hopefully every 3 years, but stay tuned on that as well.
Erin, we do have a question.
Okay, we have a question. And Erin has to read it to me because I can't see it that far.
Will there be provisions for grandparents raising grandchildren that are no longer working and fixed income?
At this time, that is not something that CCDF would allow unless the grandparents are for instance, maybe being granted under protective services. So if they're being placed in like a kinship home, then that might be an opportunity. Right now, it's the income requirements, however, still have to be met. And it is something that we know is a barrier and a problem, and it is something that we're kind of having ongoing conversations with our federal partners. Any other questions about CCAP or about the House bill? Okay, we'll move on then. Ensuring equal access, this is something that Colorado has worked pretty hard on over the last I'd say 3 to 5 years, to essentially make sure that children who receive subsidy have the same access to high quality care as their private pay counterparts. I would say House Bill 1317 and Race to the Top have made great strides in helping the state come into compliance with this. The fact that we have a quality rating system helps us kind of measure to see where children receiving subsidy are being served, and then we are able to set goals to try and improve either the quality settings of where those children are attending currently, or to improve the access to high quality care for those children receiving subsidy. So next slide, sorry. Promoting parental choice in the full range of providers, part of that ties back into our consumer education and how we empower parents to make those informed choices. But also we need to make sure that we are establishing fiscal agreements with as many providers as possible, so that when a parent walks in the door of their county human services office, that they can say that Little Minds Child Care is where my child would best thrive, and that's where I want them to go. And the county would say, great, we already have a fiscal agreement with that provider. As long as they have space, this can happen. So that is something that's a very big focus of the state right now, is to ensure that parents can really walk in the door of any high quality facility and feel good about that choice and be able to apply their subsidy to that choice. Another one is affordable copay. So House Bill 1317 from the session in 2014 established that we allow for reduced parent copays if a parent chooses high quality. So if a parent chooses a high quality provider, they get a 20% discount on their copay. Those copays are also set to be at 1% of a parent's income if they are at 100% FPL or below. That's in statute per House Bill 1317. And then we have in rule that the copays ratchet up gradually with the increase in a parent's income. Right now, those copays are topping out at 14%. In rule, it can go higher, but the system itself caps it at 14% of a parent's income. Increasing the supply of childcare, especially in underserved areas. So the department has had several goals around this in the last few years, one of which is to ensure that there's at least one high quality provider accepting CCAP in as many communities in the state as possible. So we set a goal of at least 33% of communities in the state of Colorado, and these are census communities, smaller than counties, have at least one high quality provider that accepts CCAP and actually has a child enrolled in CCAP. And we met that goal last year, and we're looking to revise that goal again. It's important to us that we have high quality care that accepts CCAP in as many parts of the state as possible. The payment rates also, this is the one that Colorado struggled with for many years. The payment rates have to be competitive with the private pay market in order to ensure equal access. I think those providers on the phone or on the webinar definitely know that if the rates are dramatically lower than what they can get in the private pay community, they're less likely to want to accept children with subsidy. So the state has worked pretty diligently with counties over the last couple of years to ensure that they're setting their payment rates at competitive prices based on tiered reimbursement rates. And so if you're a high quality provider, you're able to demand a higher reimbursement rate than a level 1 provider. And then for the last is payment practices. So the state must show that we do as much as possible to ensure that providers are paid regularly, they're paid on time, they're paid efficiently. And as many of you know, we just recently rolled out the new attendance tracking system. And while we'll have some minor pain points around manual billing and delayed billing for a little while as this rolls out. The efficiency of that system will eventually help us be even more responsive to providers as we move forward.
Question.
Okay. I have a question.
Will there continue to not be a restriction on CCAP children needing to be in licensed care?
Oh, do you mean qualified exempt? Is that Dorina?
That's Deanna Stark.
Oh, Deanna. Can we unmute her so she can clarify that question for us? Give us a second, Deanna. This is the first time we've had to unmute someone. Okay. Hi, Deanna. So do you mean qualified exempt providers?
Hi, yes, I did.
Yes. So the federal act does still allow us to provide subsidy for families who choose to use unlicensed care, so essentially family, friend, and neighbor care. And then we set those rates accordingly. There is actually requirements from the federal government that if a family is going to use unlicensed care, that provider, whether it be your neighbor, it doesn't necessarily have to be a relative, but a non-relative has to go through a series of training, as well as have a health and safety site visit to ensure that that environment is going to be safe and support the development of the child. So that went into place a couple of years ago, and all of the non-relative qualified exempt providers have gone through that health and safety site visit, and we've been working on the ones that are coming on board now. Any other questions about the qualified exempt? Great. Yeah, so is there any other questions about equal access or CCAP?
Deanna still has her hand raised, I'm not sure.
I don't know. Yeah, Deanna, do you still have a question, or maybe you have to unraise your hand? I don't know.
She does know.
Okay, great. Anyone else? Okay, great. All right, so I'm going to turn it over to Karen Rosa, our licensing administrator, and she's going to talk about all things health and safety.
So good afternoon, everybody. I'm going to talk about the standards and monitoring processes to ensure the health and safety of childcare settings. So we're required to have childcare licensing requirements. These health and safety requirements are intended to be appropriate to the provider setting, as well as the age of the children that the provider is serving. We must include specific topics and trainings on topic areas, and are subject to monitoring and enforcement procedures to ensure that providers are complying with the health and safety requirements. So some of the health and safety strategies that we use include setting standards for things like the staff to child ratios, the maximum group sizes of children in care, the qualifications for directors, early childhood teachers, assistant early childhood teachers. We also, one of the areas that they expanded was the training requirements that included both pre-service and orientation and ongoing training requirements. So some examples of that would be the safe sleep training that is free to providers on our professional development information system. Also, we have abusive head trauma shaken baby that is on PDIS. There's a link to a FEMA training, which is a disaster and emergency preparedness training that's also free for providers. It requires some immunization training, building and physical premises safety and storage of hazardous materials training. We also developed first aid and CPR module, which is not certification in first aid and CPR, but it's a module that all staff members who are not certified in first aid and CPR must take to ensure that they at least have knowledge of the first aid and CPR and can get somebody who is trained or certified. We also have transportation training requirements, standard precaution training requirements, and medication administration training requirements. So there's quite a bit of training that's required pre-service and then also ongoing. One of the other areas that was required during the pre-authorization is that we have at least one pre-service licensing inspection and then an annual licensing inspection ongoing. So we implemented that a couple of years ago and put that in place. The other, one of the major expansion areas was on background check requirements. So currently we have out for public comment the last few background check requirements that we have to have in place prior to September 30th of this year. Colorado was in a pretty good place. We had very comprehensive background check requirements prior to the reauthorization. So we were actually in a pretty good starting place. The background checks that are rules that are out for public comment right now are those that we will have to have in place by September 30th. But once we meet those milestones, you can see on this slide that there are some additional requirements, especially around interstate background checks. So if people have lived in a state other than Colorado in the previous 5 years, we will have to be checking other states' registries and repositories of both criminal and abuse and neglect registry checks, as well as their state sex offenders registry. But those will be coming in the next couple of years. So we do have to meet the milestones by September 30th of this year to be granted extensions to meet those other requirements. And I'm happy to take any questions if anybody has questions around any of those. So far.
Okay. This is Stacy again. I'm going to touch on kind of the final two sections. First, looking at recruitment and retention of qualified and effective child care workforce. This section really focuses on how we as a state are reinforcing frameworks, partnering with our higher education partners to ensure that individuals in their different roles are well qualified for the role that they're in, and that we're providing strategies and opportunities for them to further their strengths and skills relative to that framework. In this section, though, there are kind of two focus areas, and that again is related to the early learning and development guidelines, ensuring that we're supporting professionals to understand what children can and should be able to do at different ages and stages within their lives. And also a focus on business practices. So if you'll forward this slide, I'll talk a little bit about the strategies we have in place to support that. We use a couple different frameworks in Colorado. The first is the Colorado Competencies for Early Childhood Educators and Professionals. And this is kind of similar to the Early Learning and Development Guidelines in that it really outlines what professionals can and should be able to do in their different roles, and it's a competency-based system. So it really allows a professional to do a self-assessment, determine what goals they'd like to set for themselves professionally to grow in their current role or to plan for their professional growth into a new role. The Colorado Shines Professional Development Information System actually allows, it serves both as a learning management system, but also as a workforce registry. So it really does allow individuals to use the system both as a way by which to conduct that self-assessment, but also as a way for professionals to develop kind of a professional plan for themselves, and serves as a repository for various certificates that help to inform, the credential level if they're trying to pursue that as a way to satisfy minimum qualifications for licensing requirements. The second framework is really related to our large, our quality rating and improvement system, which is called Colorado Shines. And then the last, and I'll talk a little bit more in depth about that in the next section. The last framework is really the licensing requirements, those health and safety standards, making sure that we have good resources available to professionals to best understand what those are and to apply those within their practice. As mentioned, we have leveraged the Colorado Shines Professional Development Information System. This was a system that was launched in 2015, and to date we have close to 300,000 course completions, and most of the required courses, or all of the required courses that Karen Rosa had mentioned in her earlier section are made available for free to the public. So we're learning and understanding what a great resource this has been to professionals, particularly to those that live in more rural areas where weather and distance and all of those things could be problematic as they try and access opportunities in those areas. An area of focus that we're interested in growing, but that currently really only happens kind of through a face-to-face option is supporting the business practices. And so we are really outlining some strategies right now in how we can create a more robust selection related to this topic for professionals, and looking at partnering with what some might say are kind of unlikely partners with Department of Labor or, Chamber of Commerce or small business associations, those kinds of things, partners that, really have those common business practices in mind that any business, no matter what the field, would need to have in place to set a strong foundation. Excuse me. And then the last area is relative to the early learning and development guidelines. There are a number of course options available on PDIS. I know that there are also a number of related trainings made available statewide. And the Colorado Shines PDIS does allow for, or I guess I should say, serves as a way by which we can let individuals know about courses, even if they aren't made available on that system, whether it's through the community colleges or four-year universities or face-to-face in a local community. And so it really is a good resource to access frequently throughout just whenever. But this also is a place where we can advertise scholarship opportunities that might be available to professionals as well. And so if you haven't visited, please do so. I think you'll find it to be a useful resource. I'm going to pause a little bit and see if we have any questions before we move on to the next section. And seeing none, know that, again, you can always ask questions at any time but for the sake of time, I'm going to move on and talk about our strategies to support continuous quality improvement. There are states have to have in place some quality or utilize a portion of the funding to support quality activities that are intended to support the child care services and to increase parental options for access to high quality child care. And in Colorado, next slide please, we have two primary strategies. The first is the Colorado Shines Quality Rating and Improvement System. That is our primary strategy that we use with the Race to the Top Early Learning Challenge grant. We moved from a voluntary rating system to Colorado Shines, and the biggest shift that represented was we embedded licensing as the first level within that quality, within this framework. And then for level 2, there are some required steps that a program would need to do, and that's voluntary and up to the program as to whether they'd like to pursue a higher level. But to date, I would just say that we're knowing that over half of the programs have a level 2 or higher. Actually, it's closer to 53%. So when you're talking about like thousands of programs, you know, every little percentage counts. And then the levels 3 through 5 are points-based or based on a crosswalk, what we refer to as alternative pathways. So that might be a Head Start or a NACE accreditation or those kinds of things that where the standards align with the point level for a level 3 or a level 4. And the levels 3 through 5 are considered our high quality levels. Let's see, what else would I like to share with you? The framework itself is made up of 5 quality indicators. Those include family partnerships, workforce and professional development, leadership management and administration, the learning environment, and child health. And so a lot of the strategies that we have in place in developing training and resources to support the workforce really reinforce the best practices that are outlined within the framework or within the licensing requirements. The next strategy is the expanding quality for infants and toddlers. It's a 48-hour training, and it actually satisfies some licensing requirements for different roles. This is supported locally by early childhood councils, and it is in many cases, I would say most cases, offered free of charge to those professionals that are wanting to pursue this course. I guess one last thing just to mention, and that is, the strong partnership that councils also play in supporting the Colorado Shines quality improvement efforts. And so, we have made a lot of progress over the past 3 years and expect to continue to make more progress to address that access requirement and ensure that more children receiving subsidy, and certainly as many children outside of that are being served in high quality settings, because we know what a difference that makes in the trajectory of their lives. Are there any questions?
There is one question. To clarify, HB 1335 will require entry FPL to be set at 185%, correct? Will counties with a higher FPL be subjected to reduce their FPL to be in compliance?
So yes, the House Bill 1813-35 does, in some cases, reduce the entry eligibility level to 185% FPL. In those cases where a county has had a higher entry level, it will require the county to reduce their entry level for any new applications. Families that are being redetermined, meaning they're already in the program and they're being redetermined at their 12-month eligibility period, those families would remain in the program as long as they don't exceed the 85% state median income exit level. So at least for the time being, there will be families who are technically eligible today that as of July 1, or whenever the law is officially in effect, will no longer be eligible if they don't apply prior to the law going into effect. Any follow-up on that question? And again, that is something that we're going to be working on. Rule, we have to have rule in place in order to change the statewide entry level, income entry level. And so it's something that we're going to have to work on with the idea that we'll be able to change it for next fiscal year, hopefully at the latest, next fiscal year. So that would be July 1, 2019.
That was it. They said no, thank you.
Okay. Was that Danny Crane? Hi, Danny. Okay, so are there any other questions, comments? So as you review the state plan, or if this has kind of sparked interest in a different section of the state plan, please feel free to include your comments or questions in that public comment form on our website. And now we have one more question, which is great.
How do you see mental health providers supporting or intersecting with this work?
Oh.
Yeah, so the early childhood mental health consultants that are available across the state actually have a really key role in supporting this work. We know that within Colorado Shines, as an example, that's a way for programs to demonstrate that they're accessing resources to ensure best practices around supporting children's social emotional health, but also to ensure that teachers feel well equipped to support children who might be exhibiting some challenging behaviors, and to ensure that teachers feel supported to support that child, so that it doesn't lead to any unnecessary suspension or expulsion. They also can provide, I think, a nice resource to providers who are working on their policies and supporting families to understand their policies around suspension and expulsion. And I would just say generally, are an important resource for programs at that, at that local level. At the state level, we are the unit of early childhood mental health is within the Office of Early Childhood. And so that is an area where we're looking to develop more, where appropriate, online e-learning coursework that can be made available to professionals through the Colorado Shines Professional Development Information System. So we've already put out a course on implicit bias that, as an example, that was actually developed for the early childhood mental health consultants statewide, but we've received a lot of feedback from a number of directors and other staff within child care programs saying that they've actually have found the module very useful to them as they reflect on their own practices in the classroom.
Any other questions? Okay, nothing? Okay, great. So again, the public comment form is on the Office of Early Childhood website, which is www.coloradoofficeoferlychildhood.com. We also want to let everybody know if you had someone who couldn't attend today's webinar, or you've got folks across the state that are interested in attending an in-person public hearing, we have two scheduled. One is next week, Friday, May 25th, in Garfield County. It's going to be in Glenwood Springs at the Morgridge Commons, which is above the library. That address is 815 Cooper Avenue in Glenwood Springs at 10 a.m. to noon. So again, that's May 25th from 10 a.m. to noon in Glenwood Springs. And then the second and final public hearing will be Thursday, May 31st from 2 p.m. to 3:30 p.m. at the DDRC building in Jefferson County. That address is 11177 West 8th Avenue in Lakewood. So those are also on our website as save the dates. So if you couldn't write those down quickly, you can get them on our website. And we look forward to seeing some of you there. If you, again, if you have any questions, feel free to contact myself, Erin Mahoney, or Stacey Kennedy. We are both CCDF administrators for the state of Colorado. And hopefully between the two of us, we'll be able to answer your questions. Thanks so much, everybody, and have a good afternoon.